KPHA represents not only governmental health departments like the state agency and local agencies, but we also engage partners from the private sector, from healthcare delivery, from nonprofit organizations, from foundations. And we need all those partners together at the table in order to be able to make sure that we have the ability to carry out this public health work.
The annual meeting of the Kansas Public Health Association really allows us to highlight the great work that's been going on in communities. And I think what this hopefully does for our members is gives you places to start your research when you need to write a letter to the editor or you need to advocate to perhaps it's your boss, perhaps it's a city council member, kind of whatever your role in that process is. Hopefully that can be a starting point and support you in the work that you're doing.
Public health has always been an umbrella for all types of initiatives to kind of come together. And I think that KPHA is well positioned to bring some of those voices that we don't always hear from to the table, which at the end makes a stronger organization. As we ushered in the 21st century, we really confronted a new challenge in public health, a new enemy, which is chronic disease. We know in order to arrest the development of chronic disease, we really need to focus on the leading risk factors for chronic disease, two of which are physical inactivity and poor nutrition. To do that, we really have to get at kind of the root causes of how we address those issues in the state. We've witnessed really an explosion in the number of programs and the funding available to support physical activity and nutrition in the state of Kansas. KPHA provides a space to discuss public health and the challenges that we have in Kansas. KPHA has always been a strong organization, but I think over the last few years the board has made some concentrated efforts to really respond to the needs of members, and that's really been in looking at how do we do a better job as an organization to advocate for public health issues in Kansas. And when we're looking at advocating for physical activity and nutrition, two of the areas that the board has really focused on has been reauthorization of the school lunch and WIC programs, as well as making a more concentrated effort to focus on the need for and value of recess at the school level.
We're standing here at the WIG Garden. The WIG Garden was started about 3 years ago. We provide produce to WIC families to supplement the stipend that they get on their WIC checks each month. We engage the community by inviting the WIC families to come out to the garden and pick their own produce, learn about the produce, and so we have signs at the end of the garden rows. They get an education about what they're going to be offering their families, and then inside they can get recipes and information on how to cook the produce. If they learn early about nutrition, it will help prevent certain poor outcomes later on in life, preventing obesity. It will hopefully promote activity with families, and so we want to share that, and we wanted to start that with the WIG Garden.
In July of 2015, so last year, we realized in our community that there were going to be major cuts to our health department. We knew that we had to do something. And so a small group of us came together early on a Friday morning, and we called ourselves the Coalition of Coalitions, building the case for public health. While it was a real adversarial situation, and the health department specifically lost 8 positions, we also gained collaborations that we hadn't had before, which were important. And it taught us about connectivity and how we can all utilize the resources that we have better. So we launched a really robust earned and owned media campaign, and we're able to garner over 5 million media impressions in 4 weeks. More people know about public health in our community than ever before. It's hard for me to go anywhere in a social setting or for different work events where people don't say, yeah, thanks for writing the letters about public health. I didn't know that's what the health department did, or that's what public health is. So it's been a real educational opportunity as well.
We know that we have more and more uninsured, more seeking health care and safety net organizations. We've heard a lot of arguments that Medicaid isn't really a critical feature of many of our rural communities, and that's just not really true. Most of our rural healthcare systems operate off of a cost-based reimbursement type model, and most of them are operating on a negative margin. So really any increased revenue would go a long ways to providing some stability to those healthcare systems. Expansion would provide access to additional funds coming in through the communities, which would allow increased service lines, access to additional employees that could help with managing the workload that's been really kind of fraught with a lot of difficulties over the last few years. Anything that adversely impacts our healthcare system impacts our public health system, and Medicaid expansion is an important topic, I think, that needs to be thoroughly discussed in the state of Kansas.
Lead has been kind of a hot button issue in the entire nation for the past couple of years. Through the increased screening program that we started here through the Women, Infant, and Children program, we've caught several kids who haven't been screened previously. I've done different public service announcements. I've talked to different TV stations about it just to try to get education out there. That's a really big key. People don't realize that lead could be in their house. The Kansas Public Health Association, they're a really good resource to look through, to ask questions about. I've been able to be in contact with other health departments to kind of help me with the project that we're doing here.
The process of performing a community health assessment is something that many health departments do, both because it's one of the 10 essential public health services that the CDC talks about public health departments doing, but it's also required for public health accreditation. We did 537 individual interviews with households around Johnson County. This was a really great opportunity to not just have quantitative data, but to really get after those stories, those people who are out there living every day in the community, and who may need something different than we think we can provide in public health. So now that we have the data collected, we're working through our community health assessment process to do the planning for our community health improvement plan. And we're working on that with all of our partners from the community, about 20 different organizations who are going to come together and actually work collectively on addressing the issues that the data showed us exist.
The American Public Health Association was one of the 4 founding partners in the National Public Health Accreditation Board. Kansas was one of the very first recipients of an accreditation readiness grant. We were able to leverage those dollars to do some work with our public health system partners in a pre-session that occurred as part of our state public health conference. It was very early in the process, but it gave everybody a good sense of what this work was going to look like and what would be unfolding in the coming years, and we're beginning to see that realized now.
I think KPHA's role in policy and advocacy has really increased, and I'm very glad to hear that. The more that we can be active and in education, we're not lobbying, but we're advocating, and we should all be, every KPHA member should be out there advocating for public health. I think one good example of how KPHA has been successful with advocacy is its tobacco. They started out with the smoke-free bans in the cities and the state, and then most recently this Tobacco 21, and promoting the importance of smoke-free and providing testimony and letters to the editor and others such, actually going to city councils, etc., that are hearing the Tobacco 21 in their city council meeting. So I think it's great that APHA again has been very productive and very proactive in advocating and educating our legislators and our decision makers. And with our main connection, when other states have addressed issues that we're also dealing with legislatively, we can share with them, and then they've shared with us, because Kansas was kind of ahead of the game on the smoke-free laws, so some of our counterparts shared our documentation to use in their own states. So we're kind of a leader on that.
It's been a great year for Tobacco 21. It's been a little bit of a whirlwind, and in that year we've gotten 17 cities in the area to adopt Tobacco 21 policies covering 1.3 million people. So within just the Healthcare Foundation service area, 85% of youth who live in our area are in Tobacco 21 communities. And public health and the public health system has been a big part of that effort in terms of helping inform us about how to do these policies, how to enforce these policies, and always being there at the table as a good partner. Because one thing we've really learned since Health EKC is a regional effort, that every city we've gone to has needed to have a local presence and a local expert, and public health departments have been a huge part of being that local presence and expert.
There is a clear tie between economic vitality of a community and public health, and we often overlook that. And if we really want to educate decision makers and educate important, not just elected officials, but the decision makers of our community, oftentimes they need to understand that economic connectivity. And so we have been very intentional in Sedgwick County of trying to make that dotted line a little bit more solid so that they understand that if we want to attract new work sites, they want to come to a healthy workforce. If we want to keep people in our community, they want to live in a community that's vibrant and healthy. So we're trying to make sure that when we're having our messages, it's not your traditional public health folks all the time. We're trying to ask other people and other decision makers to make that message for us as well.
The role of public health in Kansas is really critical. Since the early days of Dr. Samuel Crumbine, who was really one of the national leaders in public health, that first really recognized that you had to work out across the healthcare system. It's not just clinicians and hospitals and clinics, but it's many others across the community, from the sanitarians to our environmental engineers, etc., that contribute to that quality of life in Kansas. So public health, with all of the various sectors across our communities that contribute to public health, I think it's critically important that we get more support, more understanding of the role that public health plays in the quality of life in Kansas.
I'm a true believer in the Kansas Public Health Association, along with our parent organization, the American Public Health Association, because of the value that those organizations bring to bring people together from disciplines all across public health and partnering organizations.
When we think about healthcare, we oftentimes think of it as a really personal issue of what am I doing to take care of myself or my family. And I think over time we're starting to learn that health is so much more a community value, and our health depends so much more on the people and places around us. And I think public health has a huge role to play in elevating that conversation and also figuring out what we do with that concept and what that actually looks like for the way we live our lives.